You know, Brandon, it's interesting how we spend years in training mastering the technical aspects of our specialty. The precise surgical techniques, the biology of bone healing, the pharmacology of anesthesia. All of that is critically important, of course. But I find that so much of what defines a truly successful outcome for a patient happens long after the procedure is done. It happens in their own experience of recovery and their return to normalcy.
That's a profound point, Russ. The clinical and radiographic healing is only one part of the story. The patient's psychological journey, how they feel, how they perceive their progress, and how they regain their confidence is an equally significant component of their overall health. It highlights that our responsibility as surgeons extends well beyond just the day of surgery.
It absolutely does. It's a shift from the clinical, where we're focused on millimeters and bone density, to the human, where a patient is focused on being able to laugh at a family dinner without a second thought. And bridging that gap is what we wanted to explore today. Welcome everyone to Oral Surgery Insights. I'm Dr. Russ Lieblick, and I'm with Dr. Brandon Rehrer. Today we're focusing on the profound and positive emotional impact of oral surgery, the return of confidence, function, and the simple joy that comes with a healthy, comfortable smile.
Our goal is to look at the why behind what we do by discussing the incredible transformations we are privileged to facilitate. It's a look at life after the healing is done, and how restoring oral health can so often restore a person's entire sense of well-being.
Let's start with one of the most significant transformations we see: patients who receive dental implants, whether it's for a single tooth or a full set of new teeth.
The functional gain here is immense, but the emotional gain is often even greater. That confidence comes from a very real, physical source: osseointegration. The fact that the implant is fused to the bone means it's not going anywhere. It's not like a denture that can slip or a bridge that might feel different. That physical certainty translates directly into psychological security.
And for many patients, it's about reclaiming a part of themselves. They'll say things like, "I feel like myself again." A missing tooth, especially a front one, can feel like a constant visible reminder of an injury or a long-standing problem. Restoring it isn't just cosmetic, it's a form of personal restoration.
That impact is magnified for our full-arch patients. They often go from a state of constant management and compromise with a removable denture to a state of complete freedom. It's a total paradigm shift in their daily life.
It is. We hear the most wonderful stories about this. It's the simple, profound joy of biting into a crisp apple without hesitation, or going out to a restaurant and ordering a steak without having to think about which side of their mouth they can chew on. These are experiences that can be deeply emotional and affirming.
That return to normal eating habits is huge, but the social confidence is just as important. For someone who has spent years hiding their smile in photos, or subconsciously covering their mouth when they laugh, having that space filled with a natural-looking and feeling implant crown can be truly transformative for their self-image.
It's a return of confidence that can affect their personal and professional lives in a very positive way. It's about removing a barrier that they may not have even realized was holding them back.
Another area where we see a remarkable emotional blossoming is with our corrective jaw surgery patients. These are individuals who have often lived their entire lives with a significant bite problem or a facial imbalance.
And this can affect their function and their self-perception in profound ways. The surgery is designed to correct the underlying skeletal and functional issue, but the emotional outcome is often about harmony.
When a patient has a severe underbite or overbite, their chewing muscles have been working overtime their entire lives just to compensate. They're constantly straining to function. After surgery, when the jaws are in a harmonious, stable position, those muscles can finally relax. So patients often report not just an improvement in their bite, but a reduction in chronic muscle tension and associated headaches.
And that physical relief has a huge emotional component. It's the absence of a long-standing strain they may have grown so used to, they didn't even realize how much it was affecting them. The aesthetic improvement is wonderful, but often it's that newfound physical comfort that truly transforms their day-to-day experience.
We see patients who, for the first time, can bite into a sandwich properly or breathe more easily through their nose. These are fundamental quality of life improvements. For our younger patients, especially, this can happen during a very formative time in their lives. Correcting a significant jaw discrepancy can have a profound impact on their social development and confidence as they move into adulthood.
It can be a significant journey, and there's an adaptation period as they get used to their new bite and facial balance. But the long-term emotional impact is typically a profound increase in self-esteem and the elimination of functional frustrations they may have dealt with their entire lives.
There's a different but equally powerful emotional gain for our patients who undergo surgery for oral pathology, like the removal of a cyst or tumor.
This is less about aesthetics or social function and more about peace of mind. Receiving a diagnosis of any type of growth, even a benign one, can be a very stressful and uncertain time for a patient. Before the surgery, a patient is often in a state of anxious waiting. They have a diagnosis, but the problem is still there.
The surgery in these cases is the definitive action that moves them from a state of passive worry to active resolution. Our goal is to provide that resolution with certainty. That's why obtaining clear surgical margins and getting a final pathology report that confirms complete removal is so critical.
When we can tell a patient that the lesion has been fully removed and there's no sign of any remaining issue, the feeling of relief they express is immense. It's the closing of a chapter of worry and uncertainty.
It allows them to truly begin to heal, both physically and emotionally, and move forward with their life without that constant underlying concern. It's a return to a state of health and security that is incredibly powerful.
Even with a procedure as common as wisdom tooth removal, there's a significant positive emotional impact that often gets overlooked.
That's a great point. Many young people who need their wisdom teeth removed have been dealing with a chronic, nagging, low-grade problem. It's often a recurrent issue. A patient might have a flare-up of pericoronitis that disrupts a vacation or happens during final exams. It's the unpredictability of it that can cause a lot of ongoing, low-level stress.
So, the emotional gain after removal is not just the absence of pain, but the absence of worrying about the pain. It's reclaiming that predictability in their life. They no longer have to wonder when the next flare-up is going to happen.
It's the end of a source of concern that can disrupt life at a very busy time, during school, starting a new job. While it may not be as dramatic as a full mouth reconstruction, the feeling of relief once those problematic teeth are finally gone is very real and very significant.
So, across all these different procedures, the common thread is that successful oral surgery is about much more than just a clinical fix. It's about enabling a positive change in a person's life.
It truly is. That renewed confidence we see in our patients is a direct result of the stable, functional, and aesthetic outcomes we can now achieve with modern techniques and meticulous planning. When a patient trusts their new teeth, they can forget about them and just live their life more fully.
Whether it's the joy of a new smile, the comfort of a functional bite, the peace of mind after pathology removal, or the simple relief from chronic pain, these are the stories that fuel our dedication to this specialty. They are the why behind every consultation, every scan, and every procedure we perform.
The technology, the collaboration with our restorative colleagues, our surgical expertise, all of these complex behind-the-scenes elements are pointed toward one simple goal: creating that positive, lasting, human outcome for the patient. It is a profound privilege to be entrusted with a patient's care and to be able to facilitate these positive, lasting changes in their lives.
We hope this discussion has provided an uplifting look at the positive side of oral surgery, the new beginnings and renewed confidence that are possible. It is truly the most rewarding part of the work we do.
We appreciate you all joining us for this conversation today on Oral Surgery Insights.
Thank you for listening, and we wish you a future filled with confident smiles.